I think the biggest priority for tackling antimicrobial stewardship in the UK is really changing people's attitudes and approaches and behaviours around antibiotics. And that's not just the general public and patients, but it's also how GPs see antibiotics and use antibiotics. I think the awareness from the public around antibiotic use is going to be fundamental. They have to realise that in many instances where in the past we had a degree of dependency on those treatments to improve outcome, that's no longer the case. The vast majority of infections that we see, particularly respiratory tract infections in primary care, are ones which get better with or without antibiotics.
In the community, having an option where you believe you can get symptom relief clearly will allow people to manage upper respiratory tract infection, for example, and do that in a way whereby they get the relief they're seeking without the use of antibiotics. So it's making sure that that option's there, and from my perspective, community pharmacy is the most obvious place for that to happen.
For us, it's a much bigger picture, so we're looking to try and get more people to look after themselves. One of our key pillars of the PAGB is self-care. So we believe people should be going to their pharmacist first to get that advice and guidance, and we are really pushing that very strongly. There is the self-care week that we actually push, which is a week coming up in November, and it's trying to drive people into that pharmacy to get the advice and getting pharmacists to talk to people rather than going into their GP. Because what we see is when people go into GP, the general practitioner absolutely feels that he has to give a prescription, and more often than not, he's giving antibiotics. So we can drive people into the pharmacy, getting that advice early on, that will stop that happening.